So among those living with HIV, Blacks and African Americans and Hispanic people were more likely than whites to be diagnosed with COVID-19, but they were not more likely than whites to be hospitalized or to die in the hospital. The authors suggest that these findings should place HIV seropositive people in the CDC's increased risk category for vaccine priority. Until this study, we really didn't know if there was a big increased risk for people living with HIV in terms of having a poor outcome from COVID-19. So this is one of the studies that did show that patients can have an increased risk. There are some limitations to this study. The fact that it was a retrospective study, so it was looking at data previously, and the fact that there's a lot of other confounders, but at the same time, this is data that we have to work with, and this should allow us to reach out to our health department and say, yes, those people living with HIV do have a higher risk, so they should be put in a different category for vaccine priority. These are some of the references. So, questions, concerns, comments?
Okay, I have a question.
Yes.
We were reading today that it is possible that some months, I guess, up the road, that there will have to be a booster for the Pfizer and Moderna vaccine that we've already taken. Is that how probable is that?
So some of the data is showing that these variants that we're seeing in South Africa and in Brazil, the vaccine that we have right now from Pfizer and Moderna may not be as effective, or they may not last all that long. So for that, they are actually working on a third kind of a booster to an extent to provide us protection against those variants. So that may be something that may be coming down the line. And the other important point is those vaccines weren't even, those variants weren't even discovered when those vaccines were being tested in the United States. So we didn't know how effective those vaccines would be because they weren't, those variants weren't even around. So that's the important point with the Johnson & Johnson vaccine, because those were tested in other countries as well, such as Brazil, such as South Africa. So that's an important point to make. When you compare these vaccines, the Moderna, the Pfizer, and the Johnson & Johnson, you're kind of comparing apples to oranges because the variants just were not there with the initial messenger RNA vaccinations. Dr. Anil, did you, if you want to say anything, feel free to share.
Yeah, along those same lines, I think one reason for a booster dose is to protect new variants that are popping up. And, the quicker we vaccinate, the more likely it is that we prevent further new variants from developing in this country or elsewhere in the world. And so it's part of the impetus to try to vaccinate as quickly as possible. The second reason to get a booster, so to speak, is that there could be waning immunity over time. And nobody knows when that will be. I think a lot of the specialists at the national level think that at a year after your first vaccine, you might need to get a booster dose to be able to protect the same level of immunity. But time will tell, and this will be studied in the original trial participants as they move forward.
Sorry, Dr. Suryaprasad, do you want to just introduce yourself really quickly?
Oh, yeah, I'm sorry. I'm Dr. Anil Suryaprasad. I work with Dr. Reza in Canton Community Health in Daytona. And I have a bit of a varied background in that I've worked in hospital medicine before at Mayo as well. That's where I met Dr. Reza, actually. And before that, I worked at the CDC in Atlanta, and I trained in one of those disease detective programs where you learn to investigate outbreaks and pandemics and those kinds of things. And so never really hoped that it would actually come to fruition and actually happen in real life, but here we are. And so there's a lot to learn from this past year, good and bad, and hopefully we move forward on the kind of pace that we've moved forward this year so far, because I think we've made a lot of strides in the last couple of weeks.
Fantastic. Any other questions? I have one that was just posted here. Are there any registries for pregnant or lactating women who receive the vaccine in order to monitor, study their special populations? I would have to get back to you on that. I'm not sure. There's got to be something out there, but I would have to get back to you on that. Dr. Surprasad, I wasn't sure if you were aware of anything.
Well, so beyond just pregnant women, there's a CDC registry to monitor side effects that can be reported as sort of adverse event reporting to the CDC, and it goes directly to them. It's an app that you can download on your smartphone. And one of the criteria they'll consider is if you're pregnant. And so they will get data in that way, but it's not just for pregnant women. It's more inclusive than that. So, but I think we will gain some understanding from that information.
Yeah, I mean, that data is really important. I think a lot of people have been quite concerned, understandably, in getting this vaccine when they were pregnant, but some of the recent studies are showing that this virus is quite deadly among those that are pregnant. So
I do wonder, though, if there are specific registries for lactating or pregnant women. I think that's something we can kind of look at, and maybe if there's a means of getting in contact with people and sharing that information.
sure.
Dr. Reza, I don't know if you see Kurt Wilson's question. What does it mean that 6% of adults, hold on, it just left me. Can you see it? Oh, what does it mean that 6% of adults over 65 do not have efficacy of the vaccines? Any studies about transmission of COVID on airline flights, different measures used by different airlines?
So go ahead. Kirk, could you elaborate on that a little bit more? What does it mean that 6%?
Well, you mentioned that it was 95 or 94% effective with those who are 65 or older. The vaccine was. So then I just thought, oh, well, what's up with the other 6%? Maybe it's a naive question. I don't know.
No. You know, when you look at endpoints that are studied in those Pfizer and Moderna studies, the endpoint was preventing symptomatic COVID-19 infection. And it was 94.1% effective with Moderna, 95% effective with Pfizer overall. And in the 65 and older, I think you're referring to, you know, the difference between the 94% effectiveness in the 65 and older, that means 6% not effective. That means 6% of people did get symptomatic COVID-19 despite getting the vaccine. That being said, there were no hospitalizations or deaths. And I think that's an important point with all three vaccines, that severe COVID did not happen really once people got vaccinated. And that's really the overarching goal here, you know. And if we can prevent people from getting so sick that they end up in a hospital or unfortunately dying, I think, you know, that's a huge success.
So if I understand you correctly, it means that any adult over 65 who has these symptoms doesn't have to go into a panic attack that they've got it, that it's probably going to be a relatively mild effect on them.
I think you can rest assured that you're more protected than you otherwise would have been without the vaccine, for sure.
Okay.
Yeah, that's across the board. And as Dr. Surprasad is saying, the thing that we want from any vaccine is it prevents the death and the hospitalizations and the severe outcomes. And we're seeing that all the vaccines are providing that protection, which is just so important.
And I guess the second question that Kurt had was about studies involving the transmissibility of COVID-19 in different airline venues, but I guess that could potentially apply to any venue that's commercial transportation or public settings. And the transmissibility of the virus once you've become infected, I think, is an area of interest for a lot of people. The AstraZeneca vaccine that was developed in the UK did have helpful data that showed that those that got vaccinated, there was a significantly lower proportion of those that transmitted the SARS-CoV-2 virus onto other people. But it's not known with Pfizer and Moderna. I think in the attempts to get this out as quickly as possible, when the hard outcomes of hospitalization and death and reducing COVID-19 came out, I think they didn't feel it was, appropriate to wait on transmission studies to be able to approve it, that they wanted to get this out as soon as possible. I'm sure there's going to be data that will come out in this respect as we have millions of people being vaccinated, but I don't have any information as to when or where that is coming from.
Thanks.
All right, I have a question from the peanut gallery. I have one asked, hold on. I was not able to get vaccinated, my flu shot, because of egg allergies. I guess is what it's trying to say. It's safe to say I can get the vaccine if I could not get the flu vaccine, can I get the COVID vaccine?
Yes. Yep. That's one of the points that we kind of discussed. There is no egg component in these vaccines, these messenger RNA vaccines. So both the Pfizer and the Moderna vaccines are safe to take if you previously have a history of egg allergies.
I have a quick question. This is Erica. This is like for personal myself, and also I get it from a lot of patients. A lot of people are saying they want to wait and see what happens. This is a new vaccine. They want to wait until a bunch of people have it and see, because it is scary to get vaccinated. I just started getting a flu shot 2 years ago. Before that, I never got the flu. And I'm one of those people, I would rather, hope my immune system fights things before taking medicine or getting a bunch of vaccines. A lot of people are on edge because they want to see the long run of what happens to all these people that are vaccinated. Just like chickenpox. I had chickenpox. I lived through it. Nowadays, our kids are vaccinated. They'll never get chickenpox. So it's kind of like, can your immune system fight this, or do you just get another vaccine along with all the others? A lot of people are scared. They don't know the long outcome of the vaccinations.
Dr. Neal, feel free to answer and I can chime in.
Yeah, I talked to Dr. Anil too about nature running its course, and he was like, no, you need to get vaccinated.
She's heard my perspective. You may want to take that, and then I can chime in.
Awesome, that works. So the reality, Erica, with this virus, it's a novel virus. So it's a new virus that no one in the world until last December, January in 2019 had ever seen. So it's not something that our body's ever been exposed to make those antibodies, to have those reserve armies to fight off this infection. So this is a completely new virus. So the concern is if you've never been exposed to it, your body can have a pretty severe outcome and pretty bad infection, especially for those that their immune system is weakened or they're over 65. And we're seeing even younger people have pretty bad outcomes of otherwise healthy people dying. The other important point from this is it's not about just dying. It's also the long-term effects that we're seeing from this viral infection. It's up to 10% of people can have this long hauler syndrome that we're seeing. So that can include this encephalitis, inflammation in the brain, or brain fog, your heart rate going from normal to 150 to 180 just walking around the block. And we've seen this with other viral infections. It just causes almost like a autoimmune reaction to an extent to those organs, and it disrupts your normal regulatory mechanisms, specifically kind of vagal nerve, and that blood-brain barrier. So those things are just really, and there's so much we don't know about what it causes in terms of the long hauler syndrome. So with all that said, getting this vaccine, which is quite effective with minimal side effects, is an answer for us to get to that herd immunity safely. People talk about that herd immunity where we want to, majority of the population either have been vaccinated. The other way to get to it is a lot of people get infected. If you think about trying to get 85% of the population infected with 1 to 2% of those people dying, we're talking about millions of Americans dying. So that's concerning. We're talking about 3 to 4 million Americans dying. And the other concerning part is there are different variants. Just because you were infected with one variant doesn't mean you're safe against all the other variants that we're seeing come through at this point. So that the idea of just being exposed to it and having immunity really doesn't last very long is what we're seeing. One important study that was published by the CDC back in November of 2020 looked at 156 frontline workers. So these are people that are exposed to COVID-19 on a daily basis, given their work, either they're nurses or frontline workers. They looked at and followed their antibodies for a period of time. And the surprising thing that they saw was people that were asymptomatic, meaning had no symptoms or had mild infection, their antibodies, those things that our body produced, that's what kind of the vaccine allows us to produce, disappeared after about 2 months. So about 28% of people had no further antibodies. But people that had moderate or more symptomatic infection and severe infection had antibodies that were longer lasting. So with that said, this one-time infection doesn't provide protection for the rest of our life, is what I'm saying. So that vaccine does give us a degree of protection that natural immunity just does not. So that's why it is important to get vaccinated at this point. Go ahead, Dr. Siriposa.
Yeah, I mean, absolutely agree with everything that Reza is saying. And if you think about why do we get vaccinated, period, it's to protect ourselves against getting an illness that has killed a lot of people and put a lot of people in the hospital. But there's a lot of people, particularly in younger age groups, that feel, well, gosh, I'm the likelihood of me actually getting something severe or dying is not that high. But what's so unique about this virus is how incredibly transmissible it is. It is spreading like wildfire. And if you are around anybody that could fit a high risk group, whether that be medical conditions or whether that be age, taking you back to Dr. Reza's slide on hospitalizations and death by age groups, those are incredibly high numbers of people. Or a risk of dying if you're over 65. And then if you look at the over 85 group and the hospitalization rates, the first time I ever looked at that slide, I was dumbfounded. 630 times higher risk of death if you're over 85. And if you think of the number of times that you might come in contact with somebody who's over 85 or somebody who's over 75 or over 65, whether that be family, patients, other people in the community, when we start resuming normal community activities, people go to church, people go to various venues where they socialize. The chances of giving it to somebody else that's more vulnerable is definitely very, very high. And then the third reason to get a vaccine is on a population level. We touched on herd immunity there. It takes a certain proportion of the population to all be protected by and large, mostly by vaccine. There's some from natural infection, but as Dr. Reza nicely illustrated, that can be waning immunity. And so what they have today may be different in 2 months, whereas with vaccine, it's a boosted response and it's going to last longer. And when we reach, 70 to 85%, every single expert seems to disagree with each other as to the exact percent. And the reality is everybody's throwing out numbers, and I don't think anybody knows for sure. But it's in that range of 70 to 85%. We can actually protect the entire population, including those that are not vaccinated, and actually put this virus out of circulation. And that's the ultimate goal, right? And that's what we want to do. And the faster we get to that point of getting as many people vaccinated, the less likely we are to have variant strains that could be resistant to vaccines in the future. And that's a really important point that I don't think is being emphasized enough out there, because we're starting to see the scare of something like the Brazilian variant that is not as responsive to vaccines. And people are saying, gosh, why should I get a vaccine? Well, it's all the more reason to get a vaccine, because by getting it earlier and reducing the circulation of this virus and putting it on the sidelines, we can actually stop the spread, and viruses mutate when they spread, and that's how you stop mutant strains from developing.
And on that note, Dr. Neal, it's you need that human host for this virus to mutate and become resistant or not work as well as vaccines. And the other important point is, you mentioned this previously too, Dr. Shirzad, we really don't know what's circulating in the US in terms of the variants. We likely have quite contagious variants in the US, but our monitoring system has been quite poor overall as a country. So we may have our own variants that are a lot more transmissible that we just haven't picked up just because we haven't done that sequencing testing. So when we talk about that sequencing testing, this virus, if you look at how long this virus is, the base pairs, it's about 30,000 base pairs. And when you look at that, all 30,000 base pairs and see if things have moved around and become different, that's what I'm talking about. When you do that PCR test, that nasal swab to see if you have the infection, that's only about 60 to 70 base pairs that we're looking at to see if you have active infection or not. So that is really important as well, along with tamping down the amount of rate of infection across the country. Another question, can you speak to the studies underway on children and when we might see approval of vaccines for those under 16? This is a good question. And this is one group in our population that we don't, we wait until we have enough data on the vaccines. Were not studied in that population, but there are ongoing studies at this point through both Moderna and Pfizer looking at under 16, but we should have some sort of an idea from what I've read later on this summer about vaccinating those under 16, but less than 12, the studies are going to be ongoing, and we may have more information at the year's end for those less than 12 years of age in terms of how safe the vaccine is for them. But that data is still coming. Did you have anything?
I have a question. I have, because I've had so many people ask me. One of the questions is, because I've already had COVID, and for some of the others that already have, is it still necessary to get vaccinated?
Absolutely, absolutely. Going back to the point that Dr. Reza made, that immunity antibody levels seem to wane after 2 months, and we are seeing a lot of reports of people being infected a second time. There's even been reports of people being infected more than 2 times, I think. And with the variant strains that are circulating and developing, the likelihood of reinfection is also going up as well. And so it's really important to go ahead and get vaccinated. You'll probably have a boosted immune response with vaccination, which I would look at as a good thing. And that level of protection will protect you against new variant strains, and it will give you protection moving forward when your current level of antibody protection from the infection that you got starts to subside.
And my last question, Dr. Neal, can you please let these people know how important it is to stay their butts away from that racetrack, this bike week? I mean, with everything that's going on, I just, so they can hear it from you, from Dr. Reza, just please let the peanut gallery know how important it is to stay away.
It's absolutely important. I mean, I from the very beginning of this pandemic, I've always looked at this as, what can we do for our neighbor? What can we do for the vulnerable people in our populations and in our families? And the best way of putting a virus out of circulation is removing hosts from getting infected with the virus. And if you look at transmissibility and preventive practices, at reducing transmission. We've talked so much about face masks. The most effective way of putting a virus out of circulation is to, avoid human-to-human contact. If you are not in contact, then you're not going to have virus circulating. Now, that being said, one of the side effects of a pandemic, as we've seen this year, is that it has a significant impact on mental health and on sort of social well-being, and there's an innate human nature to want to be with others and to be able to socialize, and there's a sort of a time and a place for it. And I think people should be reassured that we're not talking about being in a pandemic for the rest of our lives. There will be an end to this. Can we tell you when that end will be? Not really certain, but 2021 is going to involve masking, social distancing, hand hygiene, avoiding large gatherings, try not to go out to indoor restaurants. In indoor settings like restaurants where ventilation is poor, they've seen transmission greater than 6 feet. And what ends up happening is you have groups of people. And so one infection can turn into 10 infections very quickly. And similar to that, group events like, concerts, the Super Bowl, those, sadly, I have to put that out there, even though it happened in our own state, those kind of events, and more than just like the Super Bowl, for example, they actually in the stadium took a lot of precautions to adhere to social distancing, but then out of the stadium, you saw people gathering at bars and, partying with face masks off, and that stuff is going to lead to a surge of infections in Florida, and the more we can tamp down on that, the better we'll be. And if you look at countries across the world, there's a reason we've had the surges that we've had in the United States. It's that our ability to adjust our behavior and abide by some of these restrictions has been poorer than a lot of other countries. And those countries are in a complete different stratosphere in terms of their burden of illness. You have countries that are fretting about a few hundreds of cases, and we're talking about millions of cases. And, that's the reality of a virus that is incredibly infectious.
Yeah, I totally agree with that, Dr. Sherzad. And we're talking locally in the Daytona Beach area where they're having bike week. So that is concerning, because if you look at the map that I just shared, Florida has the highest number of confirmed cases of this UK variant. That's just so much more contagious. So we become somewhat the epicenter. And when people come and visit our state and interact and contract this variant and they go back home, it just spreads like wildfire across the country. So that's the real concern. And this is just as of yesterday. And we're really the genomic sequencing that we're doing. So likely it's a lot higher than what we're picking up on the testing that we're doing. And we already have 343 cases in Florida. So when we have these large gatherings, as much precautions as you can put in, this virus is just so infectious. Anytime people come together in close quarters, close quarters, this virus will just spread. That's how it survives.
And what is hard for me to understand is we've lived through a real world experience of a bike week that has led to the largest exponential increase of COVID-19 from any event in this country, in the world, probably. The surges the bike week in the Midwest, I think, is it South Dakota? That literally led to outbreak levels, pronounced level of transmission through secondary transmission, tertiary transmission in numerous states around the country, particularly in that Midwest area between Minnesota, South Dakota, North Dakota, Montana, Iowa. All of a sudden, you saw these being states that were leading the country in terms of rates of infections and hospitalizations, and not typically places that we see that kind of rise in disease burden. And the Sturgis Bike Week was considered to be the biggest super spreader event that we've had in this country, you know, and the fact that we're ready to repeat that in Daytona Beach is scary. It sort of dumbfounds me. I hate to put it any other way. There's not really a rational reason to do that and protect people. You're clearly putting other priorities above protecting the health and safety of the population, and that worries me.
Yeah. No, and then on top of that, you throw in this much more contagious variant. You know, Sturgis, we didn't have that more contagious variant where we.
Yeah, absolutely.
That is really concerning. And we understand the businesses.
Oh, this just in.
Huh?
Ask the doctors, why is it that when I had the flu, I was given all types of antibiotics, cough medicine, etc. But when I got COVID, all I was told to do was go home and quarantine for 14 days.
Go for it, Dr. Service.
Well, we have a problem with antibiotics being given probably too liberally and without basis. When if you have the real flu, which is a virus, there's no role for an antibiotic. And yet, if you look at the people that have the flu, a very large proportion of them end up getting an antibiotic. And, I think doctors are trained to try to treat things. We try to make people better, and we look at, treatments as a way of doing that. And the reality is, with COVID and with the flu, the best thing is to isolate and drink lots of fluids, keep yourself hydrated, keep your activity level up, and get better. And there is a treatment for the flu. It's Tamiflu, which most of you might have heard of. And the treatments for mild COVID aren't really as prominent and accepted nationwide. Things like cough medicines absolutely can be tried in somebody who has COVID-19. Things like antibiotics, though, there's some debate about the role of some antibiotics. I think, Dr. Reza, if you want to take, the role of something like azithromycin.
Yeah, it's a good important point so like the flu, COVID is a virus. So antibiotics are not effective against viruses, but you can get superimposed bacterial infections is when those antibiotics come in handy. So the infection, if it's due to a virus, it can cause inflammation in our airway. And we're always breathing in and out bacteria, that can get kind of retained, and that can cause you to have a pretty bad bacterial infection because you just have all this inflammation. So that's when the antibiotic comes into place. But with that said, you can use cough medicines, you can use Tylenol for fever reducer, for pain. There's been some role in some vitamins that have shown also better outcome in people with COVID, such as taking vitamin D supplements, zinc. These are all have some anti-vitamin C, vitamin B complex. These are over-the-counter things that do have anti-inflammatory properties, and we're seeing this cytokine storm, this inflammation with COVID infection. So from everything we're seeing, they should also help. And they're vitamins. It's not things you can really overdose on to an extent, except for vitamin D. You don't want to take excessive amounts of that. But we are seeing that these vitamins do help in the fight against the inflammation and that cytokine storm that we're seeing with COVID-19 infections.
And along that point of superimposed bacterial infections, that is more common in the flu than it is with COVID-19. It's historically, like in the Spanish flu in 1918, it is what probably contributed to a lot of people dying, was getting superimposed pneumonias from Staph aureus and other horrible pathogens that cause bacterial pneumonia. Whereas with COVID-19, I don't think that superimposed bacterial infections has been reported nearly as much.
When we're talking 1918, there was no penicillin, so we had no antibiotics. A couple other questions we had. Miss Petrina, did you want to see the one from Kirk, or you want me to read it?
I like her.
So the various mutations result in variants in transmissibility, but does the current vaccinations universally affect all mutations? So that's the important point that we're kind of bringing up about the vaccines that were initially approved in the US, the Moderna vaccine and the Pfizer vaccine. The variations that we're seeing that are seen in in Brazil and South Africa, those vaccines that are here do not seem to be quite as effective, that 94-95% effectiveness against those variants. So that is concerning. And that's why those companies are looking to making kind of a third booster shot that specifically looks at the mutations that occur in those variants and can target those mutations specifically. So even in the UK variant that we're seeing that's more transmissible, in the UK, they have detected mutations even in those UK variants where they are more looking like the South African and the Brazilian variants. The mutations have made it so the vaccines such as Moderna, Pfizer may not be as effective, but they're looking like they're going toward the same direction. If there's a silver lining in all this, we can come up with one booster vaccine that would protect us against all those variants that we're seeing across the world. So, and that is something that could be administered further down the line.
And what is exciting about the mRNA vaccine technology is the speed with which vaccines can be made. And obviously, approval processes take some time and take some studying, but the ability to come up with like literally, I remember some of the scientists, I think for Pfizer, saying that the actual vaccine technology took 2 days. The rest of the studying took months, you know, but, and I don't mean to say that in a way to say that it's not safe. I mean to say that it's simple in terms of what they need to do. They have a sequence and then they insert the sequence into a lipid and then they create a vaccine. And in comparison to other vaccines that are much more complicated in the way that they work, and the safety is inherent in the way the vaccine is made, just like Dr. Reza had described nicely at the beginning, that you just have a genetic code that's being injected into people. You don't have live virus. You don't have inactivated virus. You don't have viral particles at all. And so really, when we talk about, concern about the long-term side effects, if anything, these vaccines are likely to have less long-term side effects than other vaccines. Historically, what makes vaccines most dangerous is live vaccines that you can have with a suppressed immune system, potentially end up getting infection. And that's just not even a consideration in this situation.
Yeah. Troy had a question. Troy, I wasn't sure if I answered that question already or not. Why aren't supplements like vitamin D, zinc, and NAC talked about having these shown? So they actually have. And we know that vitamin D is important in bone health. It's also important in immune health. So those are things that have been recommended and have shown in people that have normal vitamin D level to have a better outcome in terms of COVID-19 infection. So, Troy, did you have any other questions? Feel free to unmute and ask.
No, but I think that's what Rebecca has one. She says, can you please talk about management of symptoms following the vaccine? For example, it is preferred to take Tylenol over, and it's with that word, for treatment of fever and body aches.
Yes, that's an important point. So Rebecca got her vaccine today and she's not feeling the best, that second shot. So, but at the same time, both myself and Dr. Anil have gotten the vaccine. I had a little bit of soreness in my arm, lasts for about 48 hours. So it really wasn't all that severe. An important point is not to pre-medicate prior to this vaccination, specifically with the NSAIDs. The studies have looked at non-steroidal anti-inflammatory medications such as ibuprofen or Aleve. You don't want to blunt the effects of the vaccine. you can take things like Tylenol or NSAIDs after to deal with the symptoms that you're experiencing from the vaccination, as your body's immune system has been activated to make those antibodies. So you may get that generalized ache, body ache at the site of low-grade fever. So for those things, you can take, I'd recommend taking acetaminophen initially, or Tylenol, and if that doesn't break the fever or help with the pain, trying NSAIDs after that. That would be the sequence I'd recommend.
This is Erica. I think it's important too. I heard Dr. Anil telling a patient the other day, even though you have had the vaccine, it's still important to wear a mask, because your family could still be infected. Even though you have had the vaccine, it's not sure if you can still carry it. So whoever you go home to, your kids haven't had it. So I think it's a big point too to people. Just because you've been vaccinated, it doesn't mean you're off the hook and you can just go do whatever and not carry it or not transmit it.
Yeah, that's really important point. I agree with Dr. Surpazad as well. There's a couple important points. We don't know that if you can still asymptomatically transmit the virus even after you've been vaccinated. So you may be safe and not have that severe outcome, but we don't know if you can carry the virus in our neuropharynx and pass it on. And the other important point is these vaccines, we don't know the effectiveness against these variants as we're seeing, the South African variant, the Brazilian variants. We just don't know how effective they are. And these vaccines are not 100%. They're quite high in terms of effectiveness, 94, 95%, but they are not 100%. So it's just smart to use those basic things, those barriers, those masks, and keeping that physical distance at this time as we move forward with vaccinating the rest of the population. And as a country, as more people become vaccinated within our families, once everyone is vaccinated, it will be a bit safer to get together. The risk is still there, but it's a lot less once everybody in the household has been vaccinated.
Yeah, I had a question I wanted to ask you, gentlemen. These variants that we're seeing from the UK and Brazil and South Africa, they're more transmissible. Do we have data as far as how lethal they are in comparison with the initial virus? And I guess kind of tied in with that, can you address the whole topic of viral attenuation? And are we going to see that? Are we not seeing it? And how does viral attenuation apply to COVID-19?
I can answer to that in a couple of ways. So the data for the UK variant from the UK is showing that some of that variant is possibly more deadly. That's the concerning part. And they're looking at almost 30% more fatal compared to the previous wild type that was there. You have to take all these studies with a grain of salt because they were all done in a laboratory setting to an extent. It wasn't kind of in the real world setting to some extent. And some of the studies are coming out in the real world setting as well. So from what the UK studies have shown, those may be more lethal, up to 30%. And the transmissibility of them are about 50 to 70% compared to the previous wild type virus that's out there. I'm not as certain about the lethality of the South African and the Brazilian variants, but they do seem to be somewhat lethal, and there are a lot more transmissible. I think the studies are ongoing right now in terms of looking at how lethal they are compared to the wild type virus that was initially in the countries.
I think there is some information that the South African variant at least is more lethal. And you should keep in mind that if something is magnitudes higher transmissibility as well, more people have it. And if you have a 2% rate of mortality out of 100 people, that's 2 people. Out of 1,000 people, that's 20 people. And so, it has a significant impact on the absolute numbers of deaths in society, because are we going to reach herd immunity with the consequence of a lot more people dying by getting the infection, or are we going to reach herd immunity by getting people vaccinated? Is kind of the question we're facing as a society, and that's why vaccine is such a better choice of the two.
For sure. Angel, was there specific to the attenuation? What could you elaborate on that a little bit more? Do you mean like a live virus attenuation, or what were you?
In general, just the whole topic of viral attenuation that we see in general, the viruses as they live viruses, when they tend to create mutations, sometimes they can become more transmissible, but they also can become less lethal and in time. And so my question is, why are we not seeing that with COVID in the natural evolution as we have seen with other viruses in our history?
I would say that part of attenuation has to do with our experience as a society with such an infection. And when you have a brand new infection that has never been in existence before, you have no immunity that is in society in general. And so as immunity builds up in the population, the ability of it to be as deadly as it normally is probably going to wane over the years. And I think a lot of the experts feel that with time and over the years, it will become an endemic infection, just like other coronaviruses and other wintertime viruses like adenovirus and flu and so on and so forth. But right now, you're dealing with the difficulties of the fact that this is something that was brand spanking new and have no protection against it. When that'll actually happen, I think only time will tell. I don't know if anybody knows for certain. I bet you Fauci's probably the only person that has an answer to that.
Was there any other questions that we've missed or people had? Looking at the chat box. Feel free if you guys have any other questions. Let's look at the chat. Ms. Petrina, were there any other questions from the Facebook?
No, I want to thank you. We weren't able to get on Facebook Live like I wanted to, but I do have some of the peanut gallery on the phone. So that's how we got those questions. So
I got some on Facebook Live, and thank you for my friends for joining and watching.
Yeah, so it's thank you so much again. Thank you. We did have one of the commissioners on, but he had to leave. But he was the one that was, gave some of the questions. So hopefully he would take, what was said back to, the mayor and all of those. Hopefully he would take it back to them and let them know, how serious this is. So I was hoping I could have gotten him on the mayor on the line, but nope, he did not show up. But thank you again. I appreciate it.
Share this too. So thank you guys for sharing and thank you for joining. That's what we're here for, to share.
I have one last question. This is Erica. How long do you guys foresee us having to wear masks everywhere we go?
Dr. Lay, that's the billion-dollar question.
I think definitely through the end of 2021 is what the CDC director actually said. Yeah. And beyond that, who knows?
The reality is, the quicker we can get people vaccinated, the quicker we can get back to some sort of normalcy.
Yeah.
What does that normalcy mean? It likely means wearing a mask at least throughout this year. And I'll always have to say this, the vaccine is quite effective in protecting us from severe infection, but it's not 100%. So that's why it is still important to continue to wear that mask and keeping that distance. But as a whole, as we get vaccinated, the overall burden of infection in our society goes down, the more we can relax and kind of get back to some sort of normalcy. But 2021, I think we're stuck with a mask until the end of 2021. And the other important point is, several times, I have lupus, I'm immunocompromised, I have other medical conditions, and they're scared to take this vaccine. And we totally understand that. Though that population is kind of the most at risk of having an adverse effect from this, or having a poor outcome from this virus. So they are the ones that should be getting the vaccine sooner than later. Granted, we don't have actual long-term data in people that have autoimmune processes or underlying autoimmune conditions in terms of how this vaccine will affect them. But we now have administered, close to 40 million vaccines, and we are closely monitoring that. The concern is you may not get as much efficacy if you are on medication to suppress your immune system as that 94, 95%, but you will get some, which is better than nothing at this point if you're not vaccinated. So from what we're seeing, it is effective, and it's also safe to get vaccinated if you are immunosuppressed, if you have had a bone marrow transplant, organ transplant, rheumatoid arthritis, and on medications to suppress your immune system. There is no live component to this virus, so it's not something that can cause you to have an infection, but it is safe and effective against this deadly virus. So that was one important point that a lot of people have asked me about.
Yeah, and I've heard that as well. And I think that's such an important distinction, that people with a suppressed immune system, or an altered immune system from an autoimmune illness, are more susceptible to live virus, in a vaccine. But that's not the case with this vaccine. It's all the more reason to want to get this vaccine. If your only concern is that the vaccine may not work as well, it's not that the vaccine is going to hurt you. And I think that is a point that people need to understand, and that, the chances of COVID hurting you is much higher, and that's the reality of what we're dealing with.
One last question for middle school students, because my daughter has been at home for over a year online. When would you say it's safe for children to go back? When they can have the vaccine, or?
So, go ahead, Dr. Srifasad.
Oh, you go ahead. You come from the perspective of being a parent too. So
Yeah. No, we're Erica, we hear you. We're dealing with the same thing. We have 3 little ones. It's a little bit of a zoo. Thank you, Rebecca and Daniela, for the kids and having them.
So if you and Rebecca's children were, middle school, that age, would you guys send them now, or would you recommend keeping them home?
It's such a tough question. It becomes safer, especially for those teachers. Now, children, we know, don't have as severe of an infection, and a lot of times are asymptomatic. But there are cases, numerous cases, in people having this multi-inflammatory syndrome in children. And there have been reported cases of children dying from this virus. With that said, I know children need that structure. I know children need to get back to school. It really depends on each person and their kind of situation at home and how much support they have, that they'd have to decide on their own. And this is an ongoing conversation in our household too, because this is our children's lives. God forbid something was to happen to one of our children, it would just be so devastating from this virus. So it's a work in progress, and it really depends on each person and where they are. And it also depends on the child. If you trust that they will do what they need to do, wearing that mask, keeping that social distance, that is something that's lower risk. And it's a lot lower risk if the teachers have been vaccinated throughout the schools as well, because they are the ones that can have a poor outcome given their age, given their underlying medical conditions. So for children, it is a lower risk. It's not zero, it is a lower risk. And I wish I could give you a clear answer that, yeah, send them all back. But I mean, some of the data that we're seeing in the daycare is not unlikely to be a big driver of this infection in our communities. So with that data and small children being not as, the big driver, it may be safer in younger children to go back to schools, especially schools that are taking the safety measures, wearing that mask, recommending the hand washing and not, sharing lots of utensils and doing things outside as much as possible.
Yeah, and what's tough about this topic and this conversation is that every child is different and every school is different. There are studies that have come out that in suburban Wisconsin, they've been able to effectively socially distance and enforce mask wearing and have low rates of infection in their communities, and schools have been able to open very safely. On the flip side, if you go into, inner city Jacksonville or other communities, in the South that may not be taking, social distancing and mask wearing as seriously. Is it going to be as likely that the same precautions are going to be taken? And is it going to be as likely that you're going to prevent infections? Who knows? You know what I mean? It hasn't been studied all that extensively. And the one thing, though, I think what people are saying is that there has been less transmission in a school setting than I think initially was feared would happen, which is a good thing, thank God for that, because that would have made this that much worse if we had, schools as super spreader locations. And schools are, for the most part, a lot of the schools that I've heard of are taking it very seriously in terms of trying to enforce these rules. And in some ways, mask wearing and social distancing is being enforced, with more emphasis on those preventive measures than in other areas of society. And so ultimately, every child is different. There's some children that are really falling behind with home schooling and not having the social interaction in school and not having the sort of the structure of schools. And every case needs to sort of be evaluated on its own merits, I guess.
I think another important point is depending on your child's underlying medical conditions as well. So
yeah, absolutely.
My grand.
Sorry, go ahead. Yeah, so if they have those underlying medical conditions, we know people can have a poor outcome from this virus. So really have to take each child separately and see where they are and the risk you're willing to take. And so it has to be balanced out is the reality. So that's a really important question because it's what parents are dealing with across the country. And I know the Biden administration is trying to tackle it head on. And the way to do that is to vaccinate as many people, especially those adults in those schools, so we can safely open up schools again.
And, when I say that every school system is different, every school system has a different capacity for doing contact tracing as well, which is a really important part of prevention in that if you've been in close contact with somebody who has COVID-19, you should not be coming to school. And, at one point in time here in St. John's, the high school had like 400 people that were out of school because as a result of contact tracing. I don't necessarily think that that's happening everywhere though, and if you don't have that level of attention, to isolation and precautions, the chances of more transmission is higher, right?
For sure.
If I may share a little personal story, my granddaughter had the multi-inflammatory syndrome. She was 16 years old. They live in Tennessee. She has 5 other sisters. They all have been homeschooling all their lives. Only one who became sick with COVID. They still don't know how she got it. And my daughter was telling me that she's actually in a study at Vanderbilt because she was so much older. They used to think that it was just much younger children that would get this multi-inflammatory syndrome, but apparently there's been 2 or 3 older ones like her who have recently had developed it. But anyway, just a little interesting caveat there. When the whole family tested negative and they all have always homeschooled, they still don't know how she got it, and she ended up with a multi-inflammatory syndrome. So, for whatever's worth.
No,
I'm sorry to hear that. It's a tough condition to have. Hopefully she's doing okay right now?
Yeah, she's been cleared. Cardiology cleared it. She had a little bit of cardiac issues that she was followed with long term. But my daughter just wrote me that last week, actually, she was released and clear. But she's still in the part of the study where they're going to continue to follow her long term to see what other outcomes. But yeah, I always told her she was unique, so.
No, and we're so glad to hear that she is doing better. And that's the other thing. We don't know how this vaccine transmits. I've Angel, I've heard that now several times where the husband is positive, the wife is not. You know, why? To some people, it's completely contagious. You're just sitting around people, and other people are sleeping in the same bedroom and they can't contract the virus. So we really don't know the pathophysiology of this all that well, just because it's such a new virus in our world.
My husband never got it, and I had it for 4 weeks and 2 days, and he got tested a few times. Never. He slept, and he would not leave the room, but he never got the virus.
And with that point, it's important that if you've come in exposure to somebody with COVID-19, you had a high risk exposure or with people in a closed environment for 15 minutes or longer, you don't want to get exposure or that symptom. You do want to wait that 3 to 5 days after you've become symptomatic or you've had that high risk exposure, because the virus does take about 3 to 5 days for it to make enough copies of itself to be detected on that PCR test. So sometimes people get tested really right away, then 2 days later, it's got a really high rate of false negative if it's tested too soon. So that's an important point in people that are trying to determine if they are actively infectious or not.
Yeah, the virus takes time to replicate and to be detectable. And so the optimal day to be tested is day 6. And after an exposure, I've seen so many instances where people are getting tested immediately after an exposure, and it's that fear. You worry, oh geez, was I exposed? I need to get tested. But rather than do that, you have to sort of accept the fact that the first approach is to isolate, and after isolating for 5 days, then getting tested, it would be the next step. And if the false negativity with the testing is something that has sort of confounded the whole picture and made it confusing for a lot of people.
Gentlemen, this whole issue of airborne transmissibility, not only for COVID, but just in general, I find it so interesting in my 27-year career of being in HIV care. And I have been exposed to highly infectious tuberculosis multiple times, certainly not intentionally, but I have patients that came in sick. We didn't know what was wrong with them. Subsequently, you find out that, they had highly infectious TB. And to this day, I'm PPD negative, why that is, I have no clue, because multiple times I would have guaranteed you that I would have perverted, but yet I haven't, why that is, I don't know, so I think there's a lot we don't understand about these airborne diseases and why some people that become positive for exposure to TB when, as far as they know, they haven't been around anybody that had TB, but yet they turn positive, right? And I think the same thing can apply to other airborne transmissible diseases, that there's still a lot we don't understand why some people seem to be more susceptible to becoming infected versus others.
Yeah, and I agree with that, Angel. There's a humbleness to this, that there's so much we just don't know, and so and we will find out as time goes on for sure. But thank you for sharing that experience as well. We hear you. But thank you everyone for joining.
Thank you.
Thank you for joining. Thank you everyone for sharing. And yeah, you guys have an awesome night. And I thank you again. Thank you, Katrina, for inviting us. Be well.
Thank you.